to yours. So we have the UTI and the STI. UTI is when the part, your urinary tract system, is infected with the bacteria, whilst STI is your vagina orifice. And most important, like the more you do, you interrupt or you disturb the antibodies that produce antimicrobial proteins. That's the substance found in the outer layer of your cell, that's the vaginal cells. You disturb the antibodies. So as you are douching out also the soldiers, or let's say the preventive mechanism or the antibodies that attack any infection that comes on board. Douching is not necessary for any woman. There's no medical reason to douche. I'm telling you, there's no medical reason to douche. Welcome to Health Matters with me, Village Doctor, on GN Studios. Today we're going to talk about douching. Douching. The word douching or douche means to wash or to soak. It's a French word. To wash or to soak. So douching is like a practice of washing out or rinsing out the vagina using water or some other fluids. So the practice of you washing out your vagina using water or other fluids is what we call douching. This practice has been there since 1800s. Since this practice has been there, but there are some products that we call douches. Yeah, there are products that people have. We have pharmacological products that we call douches in the system, which can be found in the feminine care centers, in pharmacies and stuff. And these are usually some mixture of baking soda and vinegar and other stuff, which is used to rinse the vagina. So the douching has been a practice of old, but it has of recent times been a major concern that it is rather increasing our risk of getting a whole lot of issues or health issues. Some may ask, does douching have benefit for some women in some situations? It's a typical no. No, in any condition. Douching is not necessary for any woman. There's no medical reason to douche. I'm telling you, there's no medical reason to douche. And douching is not necessary for any woman. So it's not like, oh, this condition, this means that I should douche or not. No, there's no medical reason for douching. There are some other, today we are going to discuss the effects of douching. About 2 or 3 points about effects. How does douching affect our vaginal health? How does that douching affect our vaginal health? 1, douching leaves the vagina vulnerable. It increases the risk of vagina to infection. And that's viral infection, bacterial infection, and yeast infection. Douching is not necessary. It's not like necessary harmful. It's not like it's not just harmful, but it can cause more harm than good. Douching can cause more harm than good. As I've talked about it severally, that the vagina naturally cleanses itself. So you don't need to clean it if everything is okay. If you've not changed the acidic level of the vagina, you don't need to clean it. It's naturally clean. You see, the cervix and the walls of the vagina creates some small amount of mucus. It naturally creates some mucus that we call, maybe if I should put it in a way for you to understand, like fluids. And this creates a small amount of carries the menstrual blood, the old cells, and other matters out of the vagina, as I've talked about. So the cell layers, as they constantly slough off, the cells that die, the sloughing of the bacteria, the viruses that are harmful, they are cleansed out in natural ways by the vagina discharging mucuses to bring them down. So you are at risk if you touch the natural mechanism of, or the natural cleansing mechanism of the vagina. So douching, first of all, leaves, the moment you douche, you are increasing the risk of the vagina to infection. That's viral infection, bacterial infection, and yeast infection. You see, many douching products alter the pH level, as I've talked about. You see, I'm much concerned about the pH level because disease-causing organisms depend on acidity and alkalinity. If their aura, the natural environment that they found to be beneficial, is changed, they tend to be harmful. So the moment you douche, you automatically alter the acidic level or the pH level of the vaginal area, and you are prone to infection, and you become prone to vaginal infection. And most importantly, not only do you become prone to, what will cause you to become prone to is like the more you douche, you interrupt or you disturb the antibodies that produce antimicrobial proteins. That's the substance found in the outer layer of your cell, that's the vaginal cells. You disturb the antibodies. So as you are douching out also the soldiers, or let's say the preventive mechanism or the antibodies that attack any infection that comes on board. You are just pushing them away, which also poses to the risk of getting yeast or bacteria or viral infection. Secondly, second point, or one of the second effects that I want to talk about when you douche is douching is associated or has a link with pelvic inflammatory disease, that's we call PID, and other UTIs. You see, when you douche, you can also push the disease-causing organism, the pathogens, the bad ones, the bad microbes. This infection, you can push them upwards into the cervix, into the uterus, even way back to the fallopian tubes. And as much as you are trying to douche, the process can end up pushing up microbes or microorganisms, infections, to the cervix, upwards into the womb, upwards, further upwards into the fallopian tubes. And the moment this get there, they pose you, you are at high risk of getting pelvic inflammatory disease, that's called PID. And PID can also cause a scar in your fallopian tube, and automatically your fertility is interrupted, or it can lead to infertility. At the same time, if your fallopian tube gets scar, when you get scar along, you see, that's the path for sperm to get to the egg or the ovaries. So the moment there is a breakage or a scar, automatically you are interrupting the flow of sperm to the ovary for fertility to take place. Thereby, your fertility level 2 is at risk. In some cases, an abscess can even form in the reproductive tract, along the reproductive tract, which can also result in pelvic inflammatory disease. And this can be a life-threatening condition. And if left untreated, it's very severe. It's very harmful. So douching is linked to, or you have one of the effects that you can get is PID, pelvic inflammatory disease, and STI. Douching may also increase the risk of developing urinary tract infection. So as you are douching, you are introducing, you see, UTIs are usually caused by fecal bacteria. UTIs are usually caused by fecal bacteria. So UTIs come as a result of introduction of fecal bacteria into the vaginal area. Likewise, the STIs. So bacteria entering the urethra as opposed to vaginal bacteria. So when you introduce fecal matter into the urethra, where the urethra, like your urinal path where you urinate, you see that instead of it entering into your vagina, the microbes rather enter into your. So we have the UTI and the STI. UTI is when the path, your urinary tract system, is infected with the bacteria, whilst STI is your vaginal orifices. So douching can cause all this. You can end up pushing microbes rather into your urethra, the part that you use to urinate, and this can cause harm because you have changed the existence of the microbes, or that microbe has been at an area that is not needed. Thereby it will cause an infection.